Well, today at noon, we're shedding light on migraines and headaches. If you've ever had a migraine, you know just how difficult it can be to work through the pain. Millions suffer from headaches and migraines, including myself. Joining us is Dr. Gloria Sims, neurologist with DHR Health. Thanks so much for being here today.
Thank you for the opportunity.
First of all, what causes a migraine?
Migraines have a genetic component, so we have the predisposition that runs in families.
All right, so can stress also bring it on?
Yes, unfortunately, once we have the predisposition, we can have different triggers like stress, lack of sleep, dehydration. There are several factors that when you form the perfect storm with certain conditions, it triggers the full migraine attack.
So I know when I get a migraine, I can sometimes feel nauseous. I need to go to a dark room. What are some of the other symptoms, common symptoms for most people?
That is exactly the most common. So usually people can have some symptoms that tells them the migraine is coming, that we call premonitory symptoms. And then when the migraine starts, you can have the light sensitivity, the sound sensitivity, the pain in your head, of course, nausea, vomiting, or any other symptoms, including problems thinking, problems operating, and basically any part of your body and brain function can be compromised during a migraine attack.
Okay, so what's the difference between a migraine and a regular headache?
So the first message that I want to leave is there is nothing such a normal headache. The head should not hurt. But some of us that suffer from this kind of chronic condition understand the difference and how much suffering it brings. A lot of things can cause headaches. It's okay that we have headaches if we have a toothache or an infection, but migraines is a type of headache that doesn't have only the pain. It also has, as I mentioned before, a lot of brain dysfunction with it, including the nausea, the sensitivity, and other weird things can happen during a migraine attack.
Okay, so what can we do to alleviate this pain?
There are several treatments. There are pharmacological treatments that, of course, you need to visit your doctors to get, but there are more important, empowering, non-pharmacological interventions that we can include. For example, cleaning up your sleep. Good sleep hygiene helps. Having some of the supplements can alleviate an acute migraine attack. And if you're at home, if you're away, and you don't have the doctor around, we can try initially some of the over-the-counter medications like acetaminophen, ibuprofen, naproxen, but most of us were trying that and then find out that it will not be working properly and need to look for medical attention.
I also hear that drinking water is helpful.
Keeping well hydrated is very helpful, especially for the prevention of the attacks. Okay. And yes, when you have a bad migraine, reassuring yourself that you are actually drinking enough water is very, very important.
I want to go back to that sleep that you're talking about. How many hours of sleep do we need?
There is not a magic number. We use the parameter of 6 to 8 hours, but some people are well slept and rested on 6 hours. I believe that it's more important to keep in mind the quality of the sleep. Because I can be in bed 10 hours, but if I'm restless, if I am not resting enough, relaxing enough, it can be as bad or worse than sleeping 4 deep, good quality hours.
So uninterrupted sleep is way better, even if it's just 4 hours or 6 hours.
That's the ideal. And listen to your body, right? Because if you feel that the number of hours that you're having are enough and you're waking up fresh and rested, that's enough and normal for you.
Okay, well, this Friday, DHR Health is having an event. You're to host an event to better understand migraines and headaches. Give us the details.
So we have a 2-part event. On Friday afternoon from 4 to 6 p.m., we're going to have the event for the community where we're going to do our best to empower and teach the community how to handle this, how to prevent, when to look for medical attention, what is an emergency cause for going to the ER, and things like that. And on Saturday, we're going to have a full-day event that is more for the medical community, nurses, and other practitioners regarding the science behind this. Some big experts are visiting the Valley to teach us more about this.
All right. Well, we thank you so much for joining us today and sharing that important information for all of us who suffer from these excruciating headaches. Again, folks, the event for the community. It is free. Understanding Headaches and Migraines happens this Friday, February 23rd from 4 to 6 p.m. at the Edinburg Conference Center at Renaissance. We'll be right back.